tuberculosis program, as well as Charles from Ministry of Health. So to start, I would like to welcome Joseph Chingalo to introduce us on this today's. Welcome, Chingalo.
Okay, thank you, Ms. Lydia. So for today's session, I think on webinar for Scorecard. So what we intend today is for today what we need to for today's session is we first to give a brief summary on what the Scorecard is. But as you know, Scorecard is one of the apps fall under DHIS apps. So we later introduce the concept of DHIS apps, that is to a clear picture of what these DHIS apps are. And we actually intended in later session probably for other apps to be able to separate the webinar for drill down dive on other features. So after being able to know what Scorecard is and that is a little bit introduction of those DHIS apps, we'll be able a chance that is for the team for us to get picture of some new or cool highlighted features for Scorecard. And later on, I think as Ms. Lydia says, we welcome artists Robert and Charles to present some use case from different implementations that they are conducting. After being able to see those use case presentation, we have a chance that is to get a picture of from where you can install the Scorecard, as well as do some configurations. And later on, we have a session that is for us to have some discussion, the Q&A sessions. But mind you, during the session, you can drop your question along the side. I think some of the speakers can respond, but if they miss out some of the question, can be later on being discussed during the Q&A session. So without further delay, so I will start with the Scorecard. So this Scorecard practical is one of the tools that we developed at DHIS Tanzania. It's a custom DHIS2 applications. And this is part of those data apps. Mind you, soon I'll give you the brief tour of all the data apps. But specifically these tools we developed to facilitate some of the key decision makers, like program manager and the M&E officers. And what actually this tool does is it usually takes some, if you have some key performance indicators, so it facilitates you to track, to visualize, and to review, but usually using some color coded. For example, here you can see one of some Scorecard. You have some several indicators like for ANC, but in some of the organization units, like of course we have some dummy locations. So as you can see, outside of there are some numbers, but using the color code, you can be able to identify at which organization unit the certain organization for a given period or given indicator, some of the performance-wise based on the colors. So as you can see from this scorecard, the green one means you are in track, so you are good. But if it's zero means you are somehow in the middle, you are just on progress. But if you are red, means you are not good, you are not at track at all. So you need to apply some intervention. So this is the tools that can, once you set up, it can be just through using some cards, it can be able to graph some, to know which indicator perform good, which not perform good, and you can do some other informed decision making. So as I said earlier, the DHIS apps now. So practical, this DHIS apps, there are 4 of them, and we develop with partnership of some organization units, like we have UNICEF who support much of our statistical during development process, together with University of Oslo and HISP Uganda, at least to make sure we've been able to develop this tool, at least to be able to facilitate on data uses. So each tools, we have a couple of them. The first one, which will be mostly discussed today, the Scorecard, which usually try to track, to visualize, to reduce the key performance indicators. But the rest of the tools, I think we'll invite you on some next webinars series, at least to give detailed ones. So we have BNA analysis or BNA app or botanic analysis. And this app usually use Taniash models to be able to determine some bottleneck on several interventions, as well to be able to identify some root cause on why those bottlenecks appear on your interventions. So once you have been identified those root cause, you can now, so the question now, you have some bottlenecks on your interventions, and you know some root cause why. So now, how can you improve or eliminate those root causes? That's where you come the BNA linked action tracker. So based on those root causes identified through the BNA app, you can now plan and track some activities that can help you to be able to intervene in those interventions so that you can eliminate those bottlenecks. So these are just BNA and BNA linked action trackers are just like one party. One for the identify the issues, and the BNA linked action tracker is one that is to be able to solve. So you can plan and try to track through the process. So and the last one is standalone action trackers. And this one is usually when you have some interventions that are not directly linked to BNA, and you want at least to be able to plan and track some activity. This is where you can be able to be able to use this another tool. I think all these tools will be later on be shared to you at least on how best you can use and implement on your implementations. So this is all at least what I want at least to share with you. But today we'll most concentrate on the scorecard. So I will welcome my colleague DHIS2 to take through at least from the features, then we'll continue on other parties. Welcome, DHIS.
Yes, thank you, Chingalo. Please allow me to share my screen. Yes, as introduced, my name is DHIS2, and I'll be sharing you some of the features within the scorecard that we have selected that are standout features that we actually believe each and every one of us who is using scorecard should at least use them for enhanced data analysis. So I'm going to highlight 5 features of the scorecard application that actually enable us to further analyze the data that we've configured within our scorecards. So the first is the specific targets feature. This is the feature that allows you to apply different legends for different periods and organization units within your scorecard. We have a further analysis feature. This feature is intended to allow you to dive deeper into the data that you see on each scorecard cell. We have a feature called highlighted items. These are very key indicators or data items that you want pinned on top of your table for quick reference and analysis while you're using your scorecard table. We also have a comprehensive and interactive user guide that will guide you on how to interact with your scorecard application on different areas. But also, last but not least, we have an impressive feature where your scorecard now can now be embedded within your DHIS2 dashboard. So we'll quickly go through each one of these features and see how they can help us in our day-to-day activities with our scorecard application. Starting off with the specific targets feature, as I said, this is the feature that is intended to allow a scorecard to have different legends for a particular data item, depending on changes in period, organization unit, or organization unit levels. And this was aimed to cater for requirements where in different use cases, you may have situations where your targets maybe change over time. In some areas, you find different organization unit levels have different targets depending on the capability and context. But as well, you may have in your organization unit, you may have very specific organization units, which are deemed to be specific and which have different key metrics and stuff like that. So you may want to have different legends for this kind of setup. So the Scorecard application now has support for this, and it allows you to configure per data item each of the legends for each of the specific use case that you have. So I'll jump in to quickly show a demo of this. So I'm in my DHIS2 demo for the scorecard. This is the link we'll share with you in the end of this session. But as you can see here, I have the my apps here. To open up my scorecard, I'll just go to the scorecard application here, and I'll quickly go through the layout of the scorecard. So this is our scorecard. This is the scorecard application within DHIS2. We will see, as you can see here, I have 3 configured scorecards. We'll see each and one of them in different aspects as we go through these features. For now, I'll just pick the immunization. So if I click on view on the immunization scorecard, I will see my scorecard here. And as you can see, we have the different areas. We have selectors for the organization unit and the period, but also we have the different legends showing what each color means within your scorecard. All of this is configurable, and we'll see it in the coming sessions on how to configure this setup. So as you can see here, we do have a button here that says specific targets library. And here is where we can now see different targets that have been set per this specific scorecard. The setup that we have here is just an example of what you can do. So as you can see here, we have specific targets for organization units, organization unit levels, and the specific period. And as I said, this is by a specific data item. So it could be a specific indicator or a data element that you are targeting. So for the organization unit, as you can see here, we have a specific target with for this organization unit, Hujehun, which is for this specific data source. So this is a certain use case that we've created that. So for Penta 1 coverage, this specific organization unit needs a bit of different legends compared to the normal legends that have been configured for that data source. And we can see the effect of this. So we can see here, this one has a bit of a more lean legend, meaning from 0 to 5, you're not on track. From 5 to 20, maybe you're in progress. And anywhere from 20 to 100 is target reached. And so if we quickly look at this organization unit here at the Penta 1 coverage, we can see now we have 23 highlighted as a target reached. This is because of that specific target. But if you can look into other organization units, you would see they have, for example, this one has 28, but it's not on track. This is because the legend that is being used here is different from the one that is being used for this specific organization unit. So that is how the specific target for organization unit works. We can also look into organization unit levels. We can decide to have different setup of legends for different organization unit levels. I'm using the Sierra Leone, which has the national district, chiefdom, and facility levels. Each one of these levels have different targets. So for example, in this case, we have the national level, which is a bit, again, it allows for more consideration. So we can see on track is anywhere between 30 to 100, and the others fall between 20 to 30. But we have more controlled values in the facility levels. So we can see they fall between either 66 to 100. And we can see the effect of this as well. So for example, in this case, we have Sierra Leone as the country. So if we look at this, this was the setup for this was for the BCG coverage under 1 year. So if we go to BCG coverage under 1 year, we'll see that because of the difference of targets per the national level, you can see the national level has achieved its goal, but the specific districts, although they're in the same, the values are comparatively similar. The values are so the color behind is different because of the different targets per organization unit level. Moving on to the last, which is the period. So we can decide for a specific data item, we can decide to have a specific legend. So for example, in this case, we're saying that for this, for measles coverage under 1 year, we want for 2024 to have a different legend from any other period. And this you can see. So for example, measles. So we have measles here. Again, you can see we have different values for year 2024 to 2025. Yeah, so that is how the specific targets within the scorecard application works. Yeah, just remind you, if you have any questions, please put them in the chat, or we can discuss further in the coming sessions as well. Moving on to the next feature, we have the further analysis feature. This is a way for you to dive into your data. For each cell that you see, you may want to know more, and you may want to know it in different views. If you want to know it, you may want to view it as a map, a chart, or a table. This feature allows you to dig deep and figure out the different formats that you can view your data. But also this allows you to view the data in period trends, as well as in lower organization unit levels for if you are dealing with higher organization unit level. So moving on to demonstration as well. So we can decide to look at any data cell, and if you click on it once, it will pop up a visualization, which is by default a chart that will allow you to view more about the specific organization unit, the specific data item you've created, and with the aggregated period. So this is a feature that allows you now to dig in further with this view. You can also decide to view it as just a single table to try and grasp it more. You can also decide for systems which have configured coordinates, you can also decide to view it as a map. So that is something that is supported within Scorecard, and we believe will continue to utilize as well. Apart from that, as I said, you can also decide to right-click. So when you right-click on any value, you'll be given a number of options that you can further select to know more about your data. So the first option here is the low organization unit. So the further analysis is just what I've shown before. The low organization unit levels allows you to dig deep for the specific cell that you've selected, if there are any low organization units for that particular organization unit role. So for example, in this case, if I look at this is Bombali, and if I want to know, like, how do the chiefdoms within Bombali constitute to this value that I'm seeing right now, I can just click on that, and I will see the different chiefdoms within Bombali and each of their values. And so this is just a quick view of seeing how low organization units contribute to the value that you're seeing. But also, right-clicking gives you a trend analysis where you can view your data in different trends of time, period of time. Across this period of time, you can view it across 3 months, 6 months, 12 months, and 4 quarters. And so these are relative periods that you can decide to view your data on. Yes, so that is the further analysis feature. I hope you also get to use it and utilize it in your normal day activities. Moving on to the another feature, we call it the highlighted items. And these are specific data items that are placed on top of your scorecard that enable you to have a quick reference when you're viewing and analyzing the data within your scorecard. So they act as reference points, making it easier for you to pinpoint this and compare them to different values within your scorecard and enhance the analysis process. So if I could go back to my list of scorecards, I have here a scorecard that is configured with highlighted items. And as you can see here, we have a number of key items that I've selected just for this demo purpose that I term as my highlighted items or highlighted data items. So yeah, so when these values, you can use them to cross-reference any value that you see on your table. You can decide to maybe make it as a base point where you want to compare this value with different values within your table. Yeah, and this just to point out, this is you can also toggle in cases where you don't want these values to appear. You can just go to the options and toggle that you don't want to see them. And yeah, so you can toggle them on and off depending on the context that you want to view. So these are the what we call the highlighted items, and of course they do also have further analysis within them, so you can decide to check for different further analysis as I've shown previously. And we also have an interactive user guide within the whole of Scorecard. And this is a way to help you and guide you when you're performing different actions within your Scorecard application. So from the list Scorecard list to the viewing of the scorecard to the configuring of the scorecard, you will have this help guide at any time you need it to be able to go to further understand what is happening with your scorecard application. So showing this, so for example, here we can see I'm now viewing my scorecard, and you see there's a help button here. So when you click on that, an interactive guide will pop up, and it will guide you on each and every area, and it will explain what the areas actually do. So you can see the different implementations here, the different things you can do with the help here, and you can see even the internal features that are within the scorecard itself, they will be highlighted, and you can actually use them to your advantage. So that is the interactive help. Of course, it's also available during the start of the app, but also when you're editing or when you're configuring your scorecard, it is also available as well. And the last but not least feature I wanted to highlight this evening is the dashboard plugin. So the Scorecard application now allows you to embed your scorecard within a dashboard, a DHIS2 dashboard. This was a feature that was possible in the past versions, but it was set as a different application. But with version 3 of the scorecard and the DHIS2 instance of up to anything later than 2.40.5 will now support the embedding of the scorecard with just one app instead of having two applications. And as I highlighted here, for anyone using the DHIS2 lower than version 2.4, there is an app in the App Hub that you can use, but we no longer support this. If you are, as stated here, if you have any version lower than 238, you can 240, sorry, you can use this. But any version higher than 240, we recommend you use the version 3 of the scorecard application. Maybe just to quickly show this. So if I go to my dashboard here, so I have already a configured scorecard dashboard here. As you can see, it looks like a normal dashboard visualization, as you can see here. You can decide to add. You can, for example, in this case, I have a dashboard that is completely scorecard. It only has scorecards, but you can decide to also put it in maybe in a setup where you have other visualizations as well. So for example, in this case, we have the different visualizations, and we have a scorecard here at the bottom. So that is also applicable. And maybe something to highlight with the new version, the scorecard version 3, the dashboard filters will now also apply to your scorecard as well. So let me use this one. So for example, if I have my scorecard here and I want to maybe filter a period, that maybe I want a specific, let's say I want a few months this year when you select on those. So the scorecard will respond to those dashboard filters. As we can see here, we now have data for January, February, and March 2025. So that is the filtering is only available for scorecard up to version 3, scorecard version 3 and above. Yes, so I would say those are the features that we wanted to show to the community about the scorecard. We hope we will enjoy and maybe use them in our day-to-day analysis. Thank you.
Okay, thanks, DHIS2 for wonderful presentation on at least to show some cool features of the new scorecard. So without further delay, I think I'll now is the time at least to see from some use cases from real implementation. So I will welcome Mr. Robert Baramba from NTLP at least to take over from here. Welcome, Robert.
Thank you, moderator. As I've been introduced, I'm Robert Barama. I'm working with National TB and Reports Program and Ministry of Health. I'll be presenting the experience of DHIS2 ETL scorecard experience from Tanzania. I'll take through this outline, but without wasting time, I'll go direct to the profile. As you can see, this is a distribution of the geographical map of our country, with 68.2 million populations, in which 51 are female, and that all these regions, 31 regions and 184 councils, have 12,846 health facilities, in which 54% of which are providing TB and reproductive services. And out of those which are providing TB and reproductive services, about 20% have TB diagnostic centers. That means at least there is one diagnostic center or site in each district, mostly molecular diagnostic. And we have 305 MDR treatment sites, and all the districts have access to DHIS2 ETL, where the data are coming from, and the primary level for data entry is health facilities. For the development of scorecards, we have built into existing DHIS2 ETL platform since 2020, in which all the data sources are from the case-based or individual level data for all TB cases and the leprosy cases. We have selected or prioritized 9 indicators, in which 7 indicators are for TB and 2 indicators for leprosy. As you can see at the right-hand side picture, the scorecard allows flexible analysis for any periods and all organization units, from the facility level to the national level, and all stakeholders, including implementing partners, have access to the scorecard. You can see the icon of our scorecard and those prioritized indicator. So for those who are not aware, our platform DHIS2 ETL just is a part of DHIS2 platform. Where we are using our scorecard uses, just the scorecard use, we have been using this scorecard, as I said, since 2020 to monitor the performance of the program. Also, the scorecard is used for regional quarterly data review meetings, even for semi-annual review meetings, and nowadays we are using for monthly visual meetings. Also, the scorecard is used for staff appraisal. For those who are doing well, they are using scorecard to score them. Also, we are using to award the best performer for annual meeting, as you can see for this picture. And that side, that's with black color t-shirt, just is a regional coordinator receiving an award from our Deputy Honorable Minister of Health, who was guest of honor in annual meeting 2023. And the picture below are all region, Rukwa, Kilimanjaro, and Mtwara. Those are awarded the best performer for the 2023. The key results or benefits of this scorecard are as follows. It has improved the visibility of our program across all level, as I said, just from the health facility to the national level. Also facilitated the identification of high-performing region and district. As you can see in this scorecard, just you can quickly pick the good performing or the high-performing region, district, or facility. Also inform deep planning for targeted support to supervision based on this indicator trend. As you can see, lead flagged region or indicator, just we can plan for intervention or supervision towards that region. And the flagging, like this green, yellow, red, and gray and white, all has strengthened data quality. Inset, that means if there is a white color, maybe no data at all, maybe due to underreporting, or NA for gray, maybe they are also underreporting, so it alerts us through scorecards. Also have enabled the monitoring of policy adherence, like the policy of test and treat all patients of TB. So all, according to our policy, just all TB patients should be tested for HIV status, and those who are non-HIV positive should be on ART. So we have selected these indicators. So through scorecards, just we can highlight or first pinpoint the region with which are adhering to this policy on test and treat all. Also, the scorecards promoted the use of data for action and the planning as some of the indicator used for basket fund and other planning at the health facility, district, and regional and national level. What are the challenges we have experienced during the implementation? There are some few challenges in this during our implementation, including limitation of the scorecard to the Group D organization unit. Some are aware that for TB program we have customized or sub-region and sub-district for TB only. So the scorecard or the DHIS2 platform is most limited for one primary organization unity. So for groups, there is a limitation. Also, interpretation of outcome indicators, example, treatment success rate or replus completion rates, that's lead to removal from the option. So we decided to remove this due to misinterpretation of indicators. These outcome indicators mostly need offset 1 year back so as to get data. And so if you use the current year, just will get, or you will lead to misinterpretation of its results. Also, another challenge, lead flooding for elimination indicators like repros. As you can see, this one, repros with grade 2 disability and those children under 15. As the more you have a higher percentage, that means the scorecard will flag with red flag because its interpretation are elimination indicators. So most lead to underreporting. So some may hide those data to avoid red flag. including scorecard is effective for both performance tracking and identifying bottlenecks, as I shown previously. Also, the importance of aligning the indicator timeframes to avoid misinterpretation, like dot treatment outcome and the loss completion indicator. Also, we have learned that we need for technical improvement to allow group reorganization, as I mentioned, for this sub-region and sub-district to avoid or to avoid some coordinator to miss scorecards, mostly applying using first facility or their administrative councils. And few are the recommendation for improvement so as to mitigate the challenges, including enhancing scorecard functionality to support cross-group org units, like I said, for those sub-region and sub-district. Also, to continue integrating scorecard output into supportive supervision, planning and data review, as we have our AFIA supportive supervision system. So we should be, while we are planning, we should be continue integrating this scorecard output into it. And lastly, to expand the training and sensitization to ensure consistent use and interpretation across the region. Yeah, as we have seen that the scorecard give a quick insight or quick picture, so it is easy to interpret or to use. So still, we should expand training and sensitization to all stakeholders to use the scorecard for decision planning and the monitoring of the indicators. Thank you for listening.
Okay, thank you, Robert, for good presentation. Good to see is not only it facilitates at least to keep track of, to monitor the key performance indicator within the program, but it also acts as a tool for accountability. As you can see, it acts as a tool for appraisal for some stuff, and some awards have been given to motivate some of the council people. So without further delay, I think I will welcome now Charles Paul. Charles, floor is yours now.
Hello, good afternoon, everyone. My name is Charles Paul. I'm working with MOH as HMOS in DHIS2. So I will just pass you through the experience sharing on the use of the scorecard in Tanzania based on the real experience. As far we know about the last presentation, that the scorecard is something in visualization that is enabling people to view the performance with the simplest language. So the role of DHIS2 in national health data management is directly in making, it helps us in making data-driven decision making. So as we know, before the introduction of Scorecard, we had the challenge of low data use, because we all know that all other visualization needs skills and experience on how to analyze and interpret data. But when we use Scorecard, we have the easily way of interpreting data. So the objective of using the scorecard in Tanzania was just to strengthening the performance and monitoring and feedback, but also to improve data use and accountability. As I said, for those who maybe they are non-health persons, or they don't have that much skills of making some kind of interpretation using graphs or pie charts or and maps, so they can use Scorecard because it just shows the color. Just color speaks loud. If you see the color, you know what performance do you exactly have. But another objective was just to facilitate the peer learning and the action planning. So we really plan according to the data that we have. And we know through the color that if we have red, we really need to emphasize on maybe resource management and put more emphasis to such indicator, which is called red and yellow and the like to the green. Now the implementation process, as Nikio said, we have so far in Tanzania, we have a lot of scorecard. After introducing the first scorecard was about a health sector basket fund. So after it shows the improvement through the visualization, now we have been introducing lot of scorecards like HMOS completeness scorecard. We have the IPC scorecard. We have the NACP scorecard in HIV. We have the oral health scorecard, the QIP, the health basket fund indicators scorecard. We also have the adolescent and the pediatric scorecard. We have PMTCT scorecard, the QIP for the both level dispensaries and health centers scorecard. So all these scorecards, they just put us in the position of making decisions through the performance we observed. Then, as far the region and the national use is concerned, the scorecard so far we have decentralized into many levels, starting from the program-specific use, like you have seen the NTLOP are using scorecard in TB and leprosy, but we have the MOH, the ministry, the pre-generated scorecards like the Ramcha scorecard, but also we have the regional selected indicator scorecard. So a regional specific can generate their own scorecard for monitoring their own indicators. So as the result now, we can see the improvement of data visualizer and the use of the facility and the district level. Now the scorecards are used to the lowest level of DHIS2 users, that's facility level, but also in the district level and the regional level, as far as also in the country level. But also we have institutionalized the regular performance of the review meetings, as we can display the data from scorecard and make the decision. We also have one of the improvements of the scorecard is the improvement of the indicator themselves, like in RMNCH indicators. We can see some indicators were scored lead and people put emphasis on those lead scored indicators, and now they are scoring green. Now here we have an example of the use of scorecard on how it was before, and after putting emphasis and energy on performing, now it turns to the green. So this example is the timeline and completeness scorecard, the comparison from the how it was started. The completeness was very, very, very poor. We can see the first column. Yeah, this is 2020, so the completeness was very, very low. But as times we are going, we download this data, we share to the different levels, and people make some efforts. And then at the end of the day, we have the current situation that we can see our data completeness and timeless is improving to the green to some sort of data sets. Now, the lesson learned, yeah, we can see the leadership buy-in is so essential, and also keeping a scorecard simple and action-oriented. As we can see, taking example of RMNCH scorecard, after the presentation of the scorecard, people are putting more efforts on and energies to make some actions to turn those red and yellow to the green. But also through the scorecard, we really need to have continuous updates and supportive supervision and integration with other review tools to enhance the impact. Now, here are the challenges and mitigations. As we know, because Scorecard has shown the great impact, but we still encounter the problem of data quality gaps. So we might also see the red in the scorecarding, but we cannot know that if it's a poor performance or it's a red because it's we have data quality issues. So we really need to have the continuous auditing, and I really thank the government of Tanzania, especially in Ministry of Health, introducing something called the DQA, the data quality assessment. The Ministry of Health is conducting data quality assessment in quarterly basis, selecting those regions with poor performing on the area of data quality. So this is it blows all about the performance, especially in those data-driven meetings. We also have the limited technical capacity, so we really need to have some sort of training and mentorship to all levels, starting from the higher level to the lower level. To the lower level, we also have some issues in connectivities. Some are the hard to reach areas, so we really need to have the offline modes, or the app that will be working offline, which will be just need the synchronization, and you can go presenting the scorecard to the areas where there are some connectivity issues. Yeah, we also have issues of maintaining engagement. As we can see, now we really recommend the advocacy and success sharing, like what we are doing now. Moving forward, we really need to expand the scorecard use to the health areas. As we can see now, we are using Scorecard in NTLOP are using Scorecard, malaria using Scorecard. So we need more health areas like WASH and other pillars to scale up and using the Scorecard for monitoring the progress and the performance of the indicators we are testing to. Then we need to integrate with the national performance framework and to automate feedback and report and alerts. We also need to strengthen the subnational ownership and sustainability. On concluding my presentation, the scorecard, we have transformed the data use culture in Tanzania by promoting the easily visualization to all those who are analysts and those who cannot doing good in analyzing data, but also promoting the transparency and accountability, also the taking action. Also, we are continuing to improve the health outcomes through the monitoring that is conducted by the scorecard. Thank you. So over to you, Chingalu. Thank you very much.
Okay, thank you, Charles, for a wonderful presentation. So at least we see some of the accountability part of what is for based on Scorecard, that is able to at least to be able to take some action across. So as of now, at least we've seen at least we've read some of what Scorecard is and it's what in general the results are, and be able to get some cool features that DHIS2 has presented to us. And we've been showcasing some use case from Robert from NTLOP and Doris Charles from HRS. Now I'm privileged to welcome Miss Isabella to take us through at least on how best we can install and as well to configure those scorecards that Gifty, Charles, and Robert they are talking about. So welcome, Isabella.
Thank you, Joseph. As introduced, my name is Isabella Allen Ngowi, Information System Analyst at DHIS Tanzania. So I'll be taking you through a scorecard installation and configuration demo. it's my belief that we are all familiar with DHIS2. Scorecard is one among the custom applications that are built on top of DHIS2. And in order for one to install Scorecard in DHIS2, their user account must be linked to a role which has app management authority. So I will quickly show you how to install Scorecard in DHIS2. And this can be done in the app management, which is found in the DHIS2 app menu. So I go ahead and select app management from the DHIS2 app menu. And within the app management, there are two options for installing Scorecard, one being from the App Hub, and another one is the manual installation. It is recommended that we use App Hub as a way of installing Scorecard because it is easy and straightforward. So I will select App Hub and will be presented with a list of applications that can be installed in DHIS2. So I'll go ahead and search for Scorecard, and there we are, presented with these options. And here we are also advised to install the latest version of the Scorecard. And for our case is version 3.00. Go ahead and select this. And once I click install, my Scorecard application is successfully installed in DHIS2. So the next step is going to be to open our Scorecard application and start configuring or creating a new Scorecard. But before we start creating our first Scorecard, we need to ask ourselves what kind of data we want to present in our Scorecard. What data item or indicators that we want to track their performances. So in this demo, we are going to focus on immunization data. So we will be creating an immunization scorecard as an example. So I'll go ahead and click Add New Scorecard button. And here we are presented with an interface whereby we are required to follow a few steps to configuring our scorecard. Now we are going to start with setting up the general information for our scorecard, which includes the title, subtitle, and description, which collectively provide the contents for the data presented. So I'll go ahead and define the title of our scorecard, which will be immunization scorecard. And subtitle and description plus the custom header are options, so I'll skip them. I'll go direct to the period configuration where we are required to set a default period for our scorecard in which data will be pulled when we open our scorecard for the first time. So I'll go ahead and select default period, and I will be provided with an interface which is similar to the standard DHIS2 period selector. So from here, I'm going to select the fixed period with the period type being year. Then I'll choose 2018 and 2019 as the default periods for our scorecard. The next part is to now configure the default organization unit or location. And scorecard can be set to pull data from a specific organization unit, such as facility, district, or region. It can also be set to pull data from a group of locations. So for our case, I'm going to select all districts and Sierra Leone. So I'll select Sierra Leone and choose district, all the districts under this location. So I have already configured the period, the default period and default organization unit. So the crucial part of the general setting is to configure the legend definition. Legend provides a visual guide to interpret data values quickly. And by default, a traffic light color scheme is used. where red indicates poor performance, yellow stands for moderate performance, and green is for target achieved. Legend also addresses no data scenarios and values outside the range by using different colors as shown above here. So this is just a default setting, but can be changed or adjusted according to the program needs. So to remove legend definition, you can just click into delete button on the right side of the legend definition. So for instance, if you want to remove not on track, you can just click delete and the legend definition is removed. And for one to add a new legend definition, they are supposed to first specify define the color from the color panel. So let's say we choose red, and when we are supposed to provide the label for that legend definition. For our case, let us put not on track. And then once we click add, we have added our legend definition to our configuration. So this is how we configure the standard, the basic settings for the general information of our scorecard. The next step is to configure to do the data configuration. And the data configuration feature allows users to set up and manage data sources, organize them into groups, and customize their display for effective analysis. So before configuring individual data items, we first need to create data source groups. These groups act as containers that organize related indicators or data items within Scorecard. So for the demo's purpose, we're going to create two groups. The first one being the coverage group, and we will later on create the dropout rate group. So to do so, I'm going to click into add group button, and I'm going to rename our first group to coverage. And within this group, that is where we are supposed to add the data items. So to do so, I'll go ahead and click add data item, and I'll be provided with the data source selector interface, where I can select either indicators, data elements, data set, or program indicator. For our case, we are going to select indicators from immunization group. So I'll go ahead and select immunization group and search for indicator coverage indicators. So in here, you can add a single data item into your group, or select multiple data items and add them at once. So on clicking add, we already have our 4 indicators added to our coverage group. So on the right side of our screen, we see a preview of the scorecard that we are creating. So as you can see, we have our coverage group here with the 4 indicators that we have assigned. So let us go ahead and create our second group. This group will be a dropout rate group, and within this group, I'm going to add 2 data items following the same procedures that I used for the coverage group. So I'll select immunization as my indicator group and search for dropout rate. So we have only 2 indicators for dropout rate in this instance, so I'm going to select both and click add. So as you can see, after adding the 2 indicators in dropout rate group, they have been presented in a preview table for our scorecard. So this is how you add the data source to your configuration. The next step is to configure the highlighted indicators, and this is optional. I'll just show you how to do so. But this highlighted indicator feature is designed to emphasize the key performance measures that require special attention. So by highlighting certain indicators, users can easily identify and monitor the most crucial data points to influence decision making. So this ensures that many important trends, grades, or even achievements are immediately visible when viewing and interacting with the scorecard. So to add an indicator, an highlighted indicator, you can just click into add a highlighted indicator and follow the same procedures for selecting indicator in the data source selector. So I'll go ahead and select our indicator from the immunization group. So I will put BCG coverage as our highlighted indicator, just as an example. And the last part in the scorecard configuration is configuring the options. So by default, we have some few elements already selected, but in brief, this part, the scorecard option feature, it provides the users with a set of configuration tools to customize how data is displayed and interpreted in the scorecard. So these options give flexibility in adjusting the layout, visibility, and analysis approach. So I will just leave this selected option as they are, but I will show you how to interact with this option when we are viewing our scorecard. So these are just a few steps for configuring scorecard. I will go ahead and save our configuration, and there we have created an immunization scorecard. So this is how the immunization scorecard is presented. We have the selected organization unit period on the top. We have the title that we defined, and here there is a region definition for our scorecard. And below here we have our organization unit, which were district listed, and on the right side we have the data presented in a color code format. So for now, our scorecard by default is set to be viewed by and edited by any user. So if one is interested to restrict the sharing settings, they can go ahead and click the share button on the top right here and restrict the access of the scorecard to only a specific group of users or a specific user. So this is also a similar feature as what we normally have in DHIS2. So for the case where you need to add advanced data configuration for a specific indicator, let's say you need to go to edit button if you have edit access, and then go to data configuration. And from here, you select that specific indicator that you want to configure its advanced setting, and you'll be provided with this interface whereby you can change the label for that particular indicator, but by default, the label is similar to the name of the indicator itself. But also we have another feature where one can define the expected maximum possible value for the data item, which can be defined here under weight. And this value indicates that any other value above this will be treated as not applicable. So in the effective gap, we can also set the logic to show whether the current value has increased or decreased compared to the previous value. And this one is represented by arrows in the table. So after setting up the effective gap, you need to check display arrow, and then your specific indicator, which in our case is BCG coverage, has data that has an arrow which is pointing downwards, indicating that this value has decreased compared to the previous value of the same indicator. So below here, one can also set the specific targets for that particular indicator, and this was explained in the highlighted indicators. So I will just skip it for now. So that is it when you want to configure the advanced settings for your scorecard. And when I click save, I will go back to my scorecard. So another thing that you can do for the case where maybe you want to link to indicators, meaning that you want to combine them into a single cell, you can click the link icon between the two indicators for you to be able to link them. So for instance, we want to link OPV0 and OPV1 indicators. So we can go ahead and click this icon here. And as you can see on the top right in our scorecard, our previewed scorecard, we have linked the OPV0 and the OPV1 in a cell. And for the case where maybe you want to rearrange the data item, you can drag and drop to the places where you want them to be. So for instance, you want measles to come first, then you can drag and drop measles. And now in our scorecard table, we have measles as our first indicator. So if you want to change the visibility or the layout of our scorecard, you can also play with the options. We have this already, the default selected items, but they can be changed at any time. And we have three parts in this option settings, whereby we have visibility options, which control how information appears on the scorecard. So by enabling or disabling these features, users can simplify or expand the view according to their preference. So legend displays the legend in the scorecard header, while the title shows the scorecard title in the header for clear identification. We have item number, which adds row number to the scorecard for the easier reference. And below here, you can show the hierarchy, which means when you want to display the full organization unity hierarchy, you can check show hierarchy. But also if you want to display the highlighted indicator that we saw when we were configuring the highlighted indicators, you can check this. And also the average allows you to filter those data values that are below average or above average. So you can select whatever you want for your data to be presented. And lastly, we have data display options, whereby we have arrows which help us to display the trend arrows within the data cells. And we have show data in rows, which switches the default table layout. So as the indicators can appear in rows and organization units can appear in column. So the last part that I'm going to show you is the download feature, whereby Scorecard allows you to download your table in Excel, CSV, and PDF format. So for instance, you can click into PDF and your scorecard will be downloaded in PDF format. And that marks the end of my presentation. Thank you.
Thank you very much, Mrs. Sabela. To at least we've passed through us on how best we can be able to install and to configure a simple scorecard, small steps, and really do some advanced operation on the scorecard. So I will welcome if there are some questions, so you can raise a hand so that we can enable you to be able to, if you have any question from different presentations that we've done. So okay, Husna, you're welcome.
Thank you. Thank you. My question about for when you install the scorecard, some of the process can go to select the district. Maybe when you have you select the district, but what about for facility? Maybe for me, I need to to select the district and the region and the facility. How can we do it? Thank you. Hello.
Yes, thank you, Husna.
Do you hear me?
Yes, we've heard you. Can you hear me?
Yeah, I'm here.
Yes. So as we were presenting, we just showcased as an example, but you can select whatever you can decide to select whatever level or organization unit you want. So maybe if I could just quickly show you what I mean. So if you're in your scorecard, so for example, in the immunization scorecard in this case, as you can see here, I have my user. So this one is user and user subunits selected. You can decide this, and this would it's recommended because it is relative to who is logging in within the DHIS2. So for example, if you are a user at the district level, which means you will see your district and the subsequent. If you select both user unit and user subunit, you'll see your district and the facilities that are within your district. But if, for example, I am a national user, that's why I'm seeing the national with its district. So for example, if I want to view, if I wanted to view my my scorecard in terms of maybe for the chiefdoms that are in Bo, I can decide to just say I'll select Bo. I can just select Bo, and then I'll say I want my. I can even target the facilities within the Bo district, and once you update, your scorecard will update with the different facilities within Bo. So as you can see here now, we have a number of facilities within Bo. I think in total there are 125. So of course, in this case, the scorecard will take some time to load, but it will show you data for all the facilities within a specific district. So the scorecard is flexible. It allows you to select any levels of organization units that you want to. Have I answered your question?
Yes, thank you. Thank you.
Yeah.
So if you have any question, you just can raise your hand, and that is so we can allow you to talk to, I think, from across, either from the technical part or anything concerning the use case, you are welcome.
Sorry. Another question, can I able to using Scorecard without DHIS2?
Yes, so unfortunately, the scorecard, this specific scorecard application is only DHIS2 based. It means you will need to have DHIS2 in order for it to work. This application does not support working outside of DHIS2.
Thank you.
Anyway, so if there are no further questions, probably we'll prepare a simple assessment of this webinar. So I will pop up the So I've requested is to share some feedback concerning this webinar. We'll continue at least to reply on some of the questions that have been raised. But meanwhile, we can at least we want you guys, if possible, we can evaluate your webinar and provide some feedback. So at least we can be able to get more feedback from this webinar and be possible later on be able to improve further on the subsequent subsequent webinars that we intend to share with you guys. So we appreciate it if you can take it sometimes that is to fill up the questionnaires that we'll share with you now. So in case if you can either using the pop-ups that have been given you, or you can just try to scan the QR code and then fill up the questionnaire so you can get some feedback from this webinar. So you're welcome. So I'll give you at least like 2 to 3 minutes, that is to get some feedback. So far we have received three feedback from participants. Michael, we have seen you in, so you can just continue if you have a question. Welcome.
Hello, everyone. Actually, it was a good session, and we grasped a lot from what you explained. But my question is, if this scorecard is feasible to work in DHIS tracker with program indicators? Thank you. Over to you.
Yes, thank you, Michael, for the question. Maybe just to quickly show that. yes, you can use your program indicators in your scorecard. So if you want to use a program indicator, when you're configuring your data configuration, you can decide to have a program indicator here as well. So you can, your programs indicators that are configured in your DHIS2 will be available here, and you can place them depending on your use case. So maybe you can look for one that makes sense. Sure, if you can also filter by programs as well. So we can maybe we can get one from TB. Program indicator there. So you can we can have maybe one that shows the average weight here, for example. So you can add it here, and you can, as you can see, we have it here now, and if we save, we will have it here, as you can see. Yeah, so of course this doesn't fall within the default legends, but yeah, so you can use the program indicators. I hope I've answered your question.
Thank you. Thank you. Yes.
So we are still waiting for some feedback. So far, we have received 20 out of 42 feedbacks. So we just had 2 minutes before we end up with our webinar. So if you are, feel free, if you have any additional questions, you can just raise your hand so we can respond to you.
Hello, Chingalo.
Hello.
Yeah, I have a question here. Unfortunately, I'm so ready to join the meeting, but I don't know. Maybe my question, I don't know my question. I'll get the answer
As
maybe
already
during the
discussed.
presentation. Yes. Hello.
So you can continue, sir.
Yeah. Okay. So my question was, I want to know the visibility of that score. Maybe after you create your scorecard. The part of visibility, maybe if you create it, it's visible for everyone to see, or you can create for your own. I want to know that part. Thank you.
Okay, thank you for your question. So actually, by default, after creating a scorecard, all the users will be able to view and edit. But there is a feature where you can restrict access to a scorecard by specifying the access level for a certain group of people, or I mean of users, or a specific user. It is similar to what we have the sharing settings of programs or data sets in DHIS2.
Okay, thank you. Maybe I know there's some changes. Okay, thank you.
Okay, thank you.
So I think I will take this privilege that is to, first of all, to thank you all for participating on this webinar, one of the first series on the data use on data use app, specifically for we specifically for today for on the scorecard. So I think as we indicate the time, I think that we thank all artists that is for listening up. Of course, we delay some 5 minutes before we start our webinar, but we manage at least to make sure we do under 19 minutes. So we'll review the feedback that you provided with us at least for so that we can improve for future webinars. But there's a couple of resources I think we'll share it on with the record of this webinar. So we've recorded all the webinars. So later on, I think we'll share the record version of the complete webinar together with some all the slides and some resources that will be useful for you guys. But feel free to reach out if you have any question concerning scorecard, or we can even better engage on how best we can improve, or we can support you on some implementations that you are currently implementing. So I'll take privilege to thank Robert and Charles for take some time that is to prepare something from their real implementation from TB as well from HRIS. And I will thank you, the team, the coordinating team, that is from East Tanzania, who have taken time at least to prepare and be able to present today. So far we are intending to have another series of webinar for another data use apps, specifically the BNA and the BNA app. So we are planned tentatively around mid February next year. So but we keep you informed based on the registration forms that we share with us. So we keep you informed on when at least in some other process for registration for the second webinar. So otherwise, I think I will thank you all, and I think we'll end our webinar from now. So good evening. I wish you all the happy weekend, all of you, and probably hope to see and engage more on different medias. Thank you all.